Our next presentation is by Brenda Nyhan, who's the James O. Friedman Presidential Professor in the Department of Government. Brendan's research focuses on misperceptions about politics and healthcare, and his presentation is pre-recorded because he's in Aarhus, Denmark today on a PhD committee. So here we go.
Thanks very much. It's great to be with you. I'm sorry I can't be there in person. My name is Brendan Nyhan. I'm a professor of government here at Dartmouth, and I'm going to be talking today about public attitudes towards vaccines and the threats posed by vaccine misinformation, politicization, as well as what we can do about it. So I'm going to go ahead and share my screen. So what I'll be talking about today is where we were before COVID, what happened during COVID, and the threats and opportunities we see after COVID. Hopefully to level set in terms of the challenges that we have in promoting public acceptance of vaccines, as well as the most emerging threats in the landscape. So I'm going to start with the modern anti-vaccine movement, which of course is only the latest manifestation of the opposition to vaccines we've seen over the centuries, really, even since vaccines were first invented. But the modern vaccine movement, anti-vaccine movement, I would date to the infamous Wakefield et al. Article depicted here, which had a substantial effect on MMR uptake in the UK. For other contexts like ourselves, the ramifications weren't immediately as detrimental, but the false claims that were made have continued to reverberate, most notably in the false belief shown here at the bottom that some vaccines cause autism in healthy children, which was something that in the late 2000s, approximately a quarter of American parents thought was true. And you can see more than half of American parents, according to this survey, indicated they agreed or strongly agreed that they were concerned about serious adverse effects of vaccines. So even though we didn't see the decreases in vaccine uptake that were experienced in the UK, these false beliefs about autism and other kinds of supposed side effects of vaccines did become quite widespread. And they did at least threaten public acceptance of vaccines. At the same time, it's important not to get caught up in doom and gloom. You can see here in one representative example that vaccine uptake was still quite high in the pre-COVID period. At least for the childhood immunization schedule, we did quite well, and we were vaccinating very high percentages of children, which is quite a remarkable achievement of public health. I don't need to repeat that point to this audience, other than to say, I think it is something that's worth reflecting on and thinking about how we can build on it in the future. There aren't too many issues in this country, maybe almost none, that we agree on as much as we agreed on vaccines in the pre-COVID era. That is a position of strength to build from, and it's where we should be hoping to get back to in the coming years. At the same time, it's important to recognize that COVID has shifted the landscape. I'm going to share some survey data with you to help you calibrate the extent to which public attitudes about vaccines have changed. And what you can see here in data from the Pew Research Center is that there is quite substantial skepticism about COVID-19 vaccines, as you of course know. To date, however, that skepticism does not extend fully to childhood vaccines, such as, for instance, here, the MMR vaccine, where you can see 88% of US adults say the benefits of the MMR vaccine outweigh the risk, compared with 62% for COVID-19. It's, of course, a shame that public acceptance of COVID-19 vaccines has not been higher, but we can take some solace in the fact that the greater skepticism we've seen around the COVID-19 vaccine has not yet fully extended to the childhood immunization schedule. And that's an important point to be cognizant of as we go forward. The threat of growing politicization, growing skepticism is one that I take very seriously, even though the polling that I'll be showing you suggests that it is not, the worst is not yet manifested. One reason for concern is the growing alignment between vaccine attitudes and party affiliation in the United States. You can see here quite substantial gaps between Democrats and Republicans in both their expressed intention to get each of the three major adult vaccines, RSV, flu, and COVID-19, as well as their confidence that the vaccines are safe. Again, COVID-19 looks the worst here, but we're seeing across the board greater hesitancy and skepticism among Republicans. And that's really unfortunate because we know that when issues in our politics divide along partisan lines, we can see those divisions congealing in ways that are very difficult to undo after the fact. So it's very important right now to rebuild the bipartisan consensus around vaccines and to prevent this issue from becoming solidified as an issue of difference between the parties, which for the most part, it was not prior to COVID. We can all think of exceptions, but in the main, it was not a highly politicized partisan issue. And that's very important to maintaining the consensus around this issue that makes herd immunity in particular possible for the childhood schedule. Another sign of risk here to the consensus around vaccines is signs of change over time in Republican attitude. So it's not just that Republicans are expressing greater skepticism. They're expressing more than they have in the past. Now you can see the sky has not fallen here when you disaggregate what Democrats and Republicans say about the measles, mumps, and rubella vaccine is one of the most well-known and controversial childhood vaccines. On the one hand, Republicans continue to overwhelmingly say the benefits of the MMR vaccine outweigh the risks, as do Democrats. So that's the good news. That's the continued public support for childhood immunization that we're looking for and we depend on. However, you can see that concern about side effects has grown among Republicans in a way that isn't observed among Democrats, and that the perceived preventive health benefits are lower than Republicans indicated in the past, looking back at previous surveys conducted by Pew in 2019 and 2016. So that's a worrisome trend. It's going to be something that's it'll be important to address going forward to prevent that kind of slippage from continuing, again, because of that concern about politicization. Another data point looking at the risk, you can see here that when we disaggregate the population of U.S. adults by party, there's been a decrease in the percentage of Americans who support school immunization mandates, which is, of course, the key to the levels of coverage we saw earlier in the pre-COVID era. We really depend on those school entry mandates to get kids covered and to keep us safe. And yet we're seeing here a decrease from 82% in 2019 to just 70% in 2023 of Americans saying healthy children should be required to be vaccinated to attend public school because of the potential risk for others. Again, we can see that decrease is concentrated among Republicans, going all the way from 79% in 2019 to just 57% in 2023 who support school mandates. Democratic support remains consistent at pre-COVID levels. So that's another worrisome trend and a potential vulnerability in the pro-vaccine consensus that we previously enjoyed. The most recent data described here by the Washington Post and summarized from the MMWR report shows exemption rates ticked up slightly in the 21-22 school year to 3.0%, the highest recorded to date. Now, it's very hard at this stage to disentangle the effects of COVID and the associated disruptions from exemptions people sought out because of changes in their vaccine attitudes. That's going to be something we're going to need to watch closely going forward to make sure that we haven't started down we haven't seen the beginning of a trend towards greater and greater exemptions, because that would be very worrisome, again, given the need to keep immunization levels above those thresholds required for herd immunity. So politicization is one threat. Misinformation is another. And again, this is one that goes all the way back to the very beginnings of vaccines. And it's played a key role both in the post-Wakefield autism myth panic, as well as the initial reaction to the rollout of the COVID-19 vaccines and the misinformation that circulated at the time. So you can see examples here of both cases, both the UK media environment, which was a key incubator of false and misleading information about vaccines during the autism myth panic. And then here on the right, examples of the way cable news and breaking news coverage misled people, overstated the prevalence of rare events, and so forth, in a way that may have contributed to vaccine hesitancy. I'm especially worried because of the way these two trends can intersect. There may be incentives in our politics, given the cracks in the bipartisan consensus I described earlier, for politicians to appeal to anti-vaccine sentiments that are now more prevalent on the Republican Party, and to invoke the kinds of misinformation we were just describing to try to rally public support to their side. We've seen that most prominently with Ron DeSantis in his presidential campaign, where he's really tried to outflank Donald Trump to his right. As a result, Donald Trump is vulnerable on the issue of vaccines. Rather than taking credit for the success of Operation Warp Speed, he has been on the political defensive as Ron DeSantis more aggressively criticizes the COVID-19 vaccine and attacks the decisions made by the Trump administration during COVID, including those associated with the vaccines. He's also, as you can see, been making statements in Florida aligned with those of his Surgeon General that are not backed by the best available science in terms of recommendations that are being made to people about the COVID-19 vaccine and its benefits and risks. So what I want to do now is just give you a sense of where people get their information about COVID and what we know from a social science perspective, where they get their information about vaccines, rather, and what we know from a social science perspective about this issue, drawing on some research that I and others have done over the years. The first point I would make is that when you think about misinformation, it's important not to overstate the frequency with which people are exposed to misinformation about vaccines online. The best available evidence we have is pre-COVID, so it's possible these data may have changed, but my co-authors and I found in web browsing data that we analyzed that exposure to vaccine skeptical web pages was quite rare and quite a small percentage of the content people saw about vaccines in general, which was a very small percentage of what people see online overall. To a first approximation, people don't see almost anything about vaccines in their web browsing, and to the extent they do, it was largely not vaccine skeptical. Okay, so the visibility of anti-vaccine folks and anti-vaccine misinformation may cause people to think this kind of content is everywhere and people are seeing it all the time. But at least in the pre-COVID period, that didn't seem to be true. I would expect us to return towards a situation like that in the coming years if we're able to resume a sense of normalcy around this issue, which is something I'll return to at the end. It is the case, however, that through all the different ways people are exposed to information, they at least say that they've heard of many of the false claims that are in circulation about the COVID-19 vaccine and associated issues like COVID treatment and the consequences of COVID. You can see here 65% of Americans, according to Kaiser, say they've heard or read the false claim that COVID-19 vaccines have caused thousands of sudden deaths in otherwise healthy people. But you can see there, as you move to the right, the percent of people who say they've heard or read the claim and believe it to be true is a minority. Not a negligible one, but certainly not the majority of Americans. You can see, depending on the claim listed there, between 14 and 29% of American adults say they've heard of the false claim in question and they think it's definitely or probably true. So I think that's a reasonable way to think about these kinds of claims. They're out there, and some people do believe in them, but they're not ubiquitous. They're not claims that everyone's heard about, or certainly that everyone believes. And that's why it's important to, again, continue to rebuild that consensus around vaccines and to counter that misinformation in the most effective ways possible. When we disaggregate those data by party and other kinds of demographics, there are quite substantial differences. Most notably, I would highlight here by party, the percentage of Democrats who say that they don't think any of those claims are true is much higher than what we observe for independents and Republicans. There are other kinds of differences along demographic lines there as well. For instance, people with college degrees much more likely to say that none of those claims are true. Now, it's of course tempting when we see misinformation to say, well, the best thing we can do to promote vaccines is to fight that misinformation. Of course, I share that sentiment subjectively, but I want to make sure that countering misinformation is really the most effective way to promote vaccines scientifically. And that's why my co-authors and I have conducted studies testing the effectiveness of presenting people with corrective information instead of other kinds of approaches. So an example here from our study conducted with a large representative sample of U.S. parents, evaluated the effectiveness of providing this factual information to parents, telling them that the autism myth was not supported by science, that the MMR vaccine would not give children autism. There was no science to support that claim. We wanted to see what effect that would have on both the beliefs of parents as well as their intentions to vaccinate a future child with the MMR vaccine. The good news is that when we showed that information to parents, they were less likely to say they believe the autism myth. So the correction in that sense was effective. It had the intended effect on their beliefs. However, when we asked them how likely they would be to vaccinate a future child, we found that the approximately the third of Americans with the least favorable attitudes towards vaccines were actually less likely to say they would vaccinate a future child rather than more. And that's, of course, the group we're most concerned about, the ones who are most likely to opt out of the vaccine schedule in part or in whole. So that's a discouraging result. It's certainly one we didn't anticipate, and it highlights the need for evidence-based approaches to determining how to most effectively promote vaccination. We can't simply assume we know the right approach. To try to go further, my co-authors and I collaborated with the Vermont Department of Public Health to test different kinds of two different kinds of messages against their standard pro-vaccine message in a large sample of parents with young children in the state. This study was unique in that we were able to observe with appropriate legal and privacy protections the actual vaccination status of children in the households in question through the state immunization registry. And what we found was both a social norm message and a myths and facts message had no measurable effect on the behavior of parents in terms of getting their kids vaccinated. Now, these messages were quite brief, and the parents' exposure to them was quite limited. It's possible that a different or more aggressive messaging approach might have been effective, but there was no measurable evidence in our study. And we think this is an important finding to indicate that it's not easy to encourage people to vaccinate, and we need larger samples and more rigorous studies with clinical outcomes in order to evaluate these claims about how to promote vaccination. What we know then is often not based on RCTs, but there are ideas, I think, that are well supported by the broader social science and public health literature. This is an article I wrote just before the vaccine rollout began in December of 2020, summarizing some of those ideas, and I'll briefly review them as I close now. One is it's important to reach people through sources they trust. And right now, I've talked about how Republicans are more skeptical, more hesitant about vaccines, especially COVID. And that's why it's going to be important for them to hear from fellow partisans who they believe share their values and point of view. It's important for them to hear from those sources about the need to get vaccinated. It's important to have high-profile folks like Mike Pence getting vaccinated and talking about why others should. And there's some evidence from one study there indicated there on the right, showing that Republican endorsements were especially effective at increasing intention to vaccinate among Republicans. An even more noteworthy study comes from some colleagues at UNC and other institutions who actually randomized ads on YouTube showing that Donald Trump wanted people to get vaccinated. And they found this measurably increased vaccination rates at the county level and quite cost effectively as well. So I think that's an encouraging proof of concept that trusted sources can be powerful, especially in pivotal moments when we're, for instance, introducing new vaccines or facing significant controversies. It's also important to do outreach through marginalized groups, which may be distrustful of conventional sources of information about health and medicine, and of course, typically for very good reasons. So identifying those partners who can effectively reach communities and groups in question will be critical in both continuing to promote COVID vaccination uptake, as well as addressing other forms of vaccine hesitancy. I would especially highlight the role of healthcare workers who are the most trusted sources of information about vaccines. Americans tell us again and again. This is a reanalysis of Kaiser data by my friend Tom Wood, showing how dramatically different the levels of trust are in people's doctors and their child's pediatricians as sources of information. There still is a gap between Democrats and Republicans, but both groups, as well as independents, rate their own doctor and their child's pediatrician as their most trusted source of health information. We need to work with and through our healthcare workers in order to reach people. They are trusted sources. I'll close by just describing where I think we need to go moving forward. And I think we're at something of a juncture right now. There's still the potential for COVID-19 to spark an escalation spiral on the issue of vaccines, where we go further and further towards politicization and battling claims over facts, misinformation. The scenario could get pretty grim. We've seen those kinds of dynamics emerge on other issues, especially as they become politicized. It's a very difficult situation to recover from. And that's why it's especially important right now to let this issue cool down and for the vaccination issue to normalize. We've done this before. The initial HPV vaccine rollout was a disaster, but since then, HPV vaccination has been normalized and very successfully increased, working through conventional channels in a manner that builds trust, often through people's doctors and pediatricians. That's the same kind of issue, the same kind of approach we should be taking on vaccinations now, not just on COVID, but for all the vaccines that might be subject to this kind of politicization. So just to conclude then, the research suggests that we shouldn't assume the most important way to promote vaccination is correcting myths. There's at least some evidence to suggest that approach is ineffective, potentially even counterproductive. In general, I don't believe there are messages that will change everyone's mind, but we can do our best to promote vaccination through sources people trust. And in the process, hopefully we can minimize the kinds of partisan conflict that threatens the public consensus that's so important to delivering the benefits of vaccines to everyone, both here in this country and around the world. Thanks very much, and I hope the rest of the conference goes great.